And in the TUC, we've been proud to coordinate the All Together for the NHS campaign. It's an unprecedented alliance of unions, royal colleges, professional groups, health service staff, patients, members of the public. And together, we're speaking up for a publicly accountable health service, for the values that make our NHS so special, and indeed for the ethos of public service itself. And with the Health and Social Care Bill still over there in the House of Lords, it's vital tonight, while there's still time, that we make our voices heard. And so this evening, we're telling them, aren't we? We're telling them our NHS is not for sale, must never be for sale. Now, not tomorrow, never. And let's be in no doubt. This bill represents the biggest ever threat to our NHS. It'll mean £3 billion spent on change instead of care. NHS patients pushed to the back of the queue by those with fatter checkbooks, and a postcode lottery of provision. And it'll also mean, won't it, privatisation on a huge scale, with our health service opened up to competition from any willing provider. And we know what they'll do, don't we? Private firms, well, they'll profit by cherry-picking the easiest, the most lucrative work, leaving the taxpayer to pick up the tab for everything else. So let's be clear. This is a bill that's wrong for patients, wrong for the public, and wrong for Britain. And that's clear because as we can all see, virtually nobody wants these reforms. Almost nobody supports them. And what's crystal clear, nobody voted for them either. Just cast your mind back to the last general election. Do you remember what David Cameron said? There'd be no top-down reorganisation of the NHS. Well, what we've got is now reforms that the chief executive of the NHS says are so big they could be seen from space. David Cameron also said, didn't he, NHS spending would be protected. But instead, we've got big cuts and over 50,000 NHS staff, including doctors and nurses, facing the loss of their jobs. And David Cameron said too, didn't he, that the health service would be in his hands. Instead, we've got the biggest, most dangerous upheaval in the 64-year history of this vital service. And of course, the government won't even publish the risk register spelling out the range of threats that the service now faces from this bill. So, the Prime Minister needs to understand this. If he presses ahead with this reckless, ill-conceived, expensive bill, he will pay a devastating political price. So, colleagues, the stakes couldn't be higher. The NHS is one of Britain's defining achievements, and we will not allow this government to destroy what has taken generations to build. So let's build the widest possible coalition against these reforms. Let's work with peers and members of Parliament, even at this late stage, to try to stop this bill in its tracks. And together, let's save our NHS. Thanks for listening.